Good afternoon. My name is Jennifer Robinson, and I will be discussing heart failure today. The learning environment that I will be at today is the community college classroom with associate degree nursing students, adult students at least 18 years old with varying ages. Educational level varies from first degree students to a second career students. In preparation for the class, the students were required to complete the following assignments. Read Hinkle and Cheever, chapter 25 and 29. Watch Heart Failure Patient Education by the American Association of Heart Failure Nurses on YouTube. And now we'll get started with the learning objectives for heart failure. The learning objectives for heart failure: upon completion of this unit, the student will be able to define heart failure, describe the pathophysiology of adult patients with heart failure, describe clinical management of adult patients with heart failure, describe patient home care education for heart failure. The healthy heart pumps blood into the aorta. So what is heart failure? This addresses objective 1, and heart failure, commonly known as congestive heart failure, CHF, is a clinical syndrome that can result from any functional or structural disorder, cardiac disorder, that impairs the ability of the heart to fill and eject blood. Inadequate perfusion of the tissues due to decreased cardiac output, which is systolic, failure and or increase in pulmonary capillary pressures due to increased diastolic filling pressure, which is known as diastolic pressure. The blood pretty much moves at a slower rate with congestive heart failure. CHF occurs when impaired function renders the heart unable to maintain output sufficient for the metabolic requirements of the body, or can only do so at elevated filling pressures. Puts more strain on the heart. CHF is characterized by diminished cardiac output, which is forward failure, and accumulation of blood in the venous system, which is backward failure, or both. About heart failure, about 5.7 million adults in the U.S. have heart failure. 1 in 9 deaths in 2009 included heart failure as a contributing cause. About half of people who develop heart failure die within 5 years of diagnosis. Heart failure costs the nation about $30.7 billion each year. And this total includes the cost of healthcare services, medications to treat heart failure, and missed days of work. The causes of heart failure can be coronary artery disease, hypertension, cardiomyopathy, valvular disorders, renal function with volume overload. Pathophysiology, which addresses objective 2. CHF results from a complex interaction between factors that affect the contractility, afterload, preload, and lusotropic function of the heart, and the subsequent neurohumoral and hemodynamic responses that seek to create circulatory compensation. Most frequently, heart failure occurs due to progressive deterioration of myocardial contractile function, which is systolic dysfunction. Causes include ischemia, pressure, or volume overload due to valvular disease or primary myocardial failure. The inability, diastolic function, just what we discussed, of the heart chamber to relax and fill during diastole. Causes include hypertrophy, most common, fibrosis, amyloid deposition, or constrictive pericarditis. The signs and symptoms, we're mostly going to talk about heart failure in general today. However, I will address the different signs and symptoms depending on the part of the heart that is backing up, forward failure or backward failure. Signs and symptoms for left-sided heart failure, shortness of breath, orthopnea, paroxysmal nocturnal dyspnea, cough, pulmonary crackles. Anything that backs up to the pulmonary, it will be congested. You may see weight gain, rapid weight gain, dependent edema, abdominal bloating, ascites, jugular venous distension, and sleep disturbances, with the patient being have anxiety or heavier hunger. Poor perfusion is going to be the right-sided heart failure, and that is low cardiac output. Again, the heart is not able to move blood. It's forward failure. Decreased exercise tolerance, muscle wasting, anorexia, nausea, unexplained weight loss, lightheadedness or dizziness, confusion, altered mental status, resting tachycardia, daytime oliguria and recumbent nocturia, cold or vasoconstricted extremities, pallor or cyanosis. The common medications of Objective 3 that treat heart failure. Most of the treatment for heart failure is going to be medications. Diuretics are going to help to keep the fluid off, also known as water pills. ACE inhibitors reduce the workload and help reduce heart remodeling. Beta blockers reduce the work on your heart. The aldosterone antagonists help keep fluid off the heart, and reduce heart modeling. Digoxin helps strengthen the heart. Bideal helps your blood vessels relax to make it easier for your heart to pump blood. Lifestyle recommendations are for patients, patient education as well. Restrict dietary sodium, avoidance of smoking, avoidance of excessive fluids, avoidance of alcohol intake, weight reduction when indicated, regular exercise. Objective 4, the patient education for heart failure. We just briefly discussed these. Weigh daily, encourage your patients to weigh daily, and document their weight daily. Take medications exactly as directed. Follow a low sodium diet. Avoid drinking excess fluids and alcohol consumption. Maintain a normal body weight. Objective 4 again, regular exercise. Know the warning signs of heart failure, when to come in, stop smoking, and keep follow-up appointments. Make this a permanent part of your life. To evaluate this presentation of heart failure, and if students fully understand the lecture and to meet the objectives, there is going to be a post-quiz. The post-quiz is included. However, students will complete the post-quiz and turn it in prior to leaving the classroom. Also on Blackboard, there is a case study. It is posted and open to Blackboard at this time. Please, I'm going to ask the students to go ahead and pull the case study, complete it, and upload it due tomorrow morning by 8 o'clock via Dropbox on Blackboard. References for this presentation are also included, and I appreciate it, and y'all have a good day.